So these are the objectives of my lecture. So we'll first discuss about briefly the role of neurodevelopmental pediatrician, the developmental milestones, red flags of developmental delay. We'll briefly talk about the common neurodevelopmental disorders, the importance of early referral and intervention, and the effects of COVID-19 pandemic in children. So what is the role of neurodevelopmental pediatrician? So the developmental behavioral pediatrics is a relatively young field among the pediatric subspecialties, especially here in the Philippines. So there's around almost 90 of us practicing here in the entire Philippines. So a neurodevelopmental pediatrician differs from a developmental behavioral pediatrician in the sense that we have extra training in neurology, which since most of the neurodevelopmental disorders have brain-based etiologies. So what do? We usually assess a child who has a developmental, learning, or behavioral problem. We view children's development and behavior in the context of their families and the community, assess overall functioning, including family, school, and social stressors. We also provide a diagnosis and recognize associated syndromes and underlying neurological, metabolic, and genetic conditions for necessary investigations and treatment by relevant subspecialties. So the common developmental and behavioral issues we encounter in our clinics or the reason for referrals include delayed development, like in speech, motor, social skills, or adaptive skills, learning difficulties, which are very common in school-age children, attention and behavioral issues, also common in preschool children and school-age children, regulatory disorders or those with sleep, feeding concerns, tantrums, and developmental disabilities, such as those with neurologic conditions such as cerebral palsy, intellectual disability, autism spectrum disorder, visual and hearing impairments. So we usually counsel and provide treatment to children, adolescents, and their families with a wide range of developmental and behavioral difficulties. So we also try to coordinate within the team members of multidisciplinary team. For example, the neurologists, the occupational speech therapists, and of course, with the teachers. Okay, we also provide recommendations such as doing necessary laboratory tests, IQ testing, or workup such as EEG or hearing tests. We also try to collaborate with other institutions or other professionals. We also guide the parents in terms of proper school placement of the child. And last week, we can also prescribe medications for those children needing medical treatment, such as those with ADHD or attention deficit hyperactivity disorder. So how do we conduct neurodevelopmental evaluation? So first, we always take a detailed history. We ask for parental concerns. We try to review medical and psychosocial risk factors of the child and check for development and behavior. So during the examination, we try to conduct physical and neurological examination and administer developmental tools. So this would differ depending on the clinician. So most of the tools we use here in the Philippines actually came from, like the one with Griffiths came from UK, and the Battelle Developmental Inventory Scale came from the US. Okay, we try to provide additional medical screen as needed and provide plan of management, like doing laboratory tests, hearing tests, CT scan, or MRI. And then we make the necessary referrals for therapy or educational intervention. Okay. So usually, when we do our history taking, we try to elicit the different developmental milestones and observe for any red flags of developmental delays. So how do we determine if the child is doing well or if we have to worry about certain skills or behaviors? Okay. So neurodevelopment is a very complex and dynamic process. It commences at birth and proceeds in a predictable sequence and rate. So when we say developmental milestones, it represents the product of developmental process. So each milestone a child acquires builds on the last milestones developed. So every child is unique, and so is his exact developmental path. So the skills acquired within a specific time frame occurs in a sequential manner, and it's a general guide to typical development for us parents, teachers, and the therapists. Okay. So when we talk about developmental milestones, we usually divide it further into 5 subdomains, which are the motor, adaptive, cognitive, personal, social, and language domains. So when we talk about motor skills, it is further divided into gross motor and fine motor, which determines the strength or physical skills of the child. Language includes receptive and expressive language. Personal social is how children interact with others and process their feelings. Cognitive includes thinking and problem solving. And adaptive includes practical and everyday skills. So the domains of development are interlinked and interrelated so that the child's progress in one domain influences the progress in other domains. Okay. So expected milestones are what the child can do by a certain age, while when we say red flags, what a child cannot do, but most children already can. So when we encounter red flags, it suggests the need for further assessment. So milestones can help us recognize the child development may be different and help us to determine if there is a further need to refer to a specialist. Okay. So briefly, I'll just give some examples of the age expected milestones and then the common red flags that we encounter per area of development. So since most kids enter school at around preschool age, which is around 3 to 4 years old, these are the expected gross motor milestones. Okay. At 4 years old, they're expected to catch or throw ball. 5 years old, these are expected to be able to hop or skip. And at 6-year-old, they're able to do tandem walk. Any child struggling with balance and coordination have difficulty catching ball or difficulty hopping or unable to walk straight line back and forth or balance are common red flags in this area. In terms of fine motor, so usually at 4 years old, we expect the child to have better grip of the pen or pencil. And at 5 years old, they should have the dynamic tripod grip or the mature grasp for pencils. So usually at 4 years old, we expect them to copy simple figures. And then at 5 years old, they'll be able to start cutting with scissors. And at 6 years old, they're able to write their complete name. So problems with eye-hand coordination or a difficulty stacking objects, unable to copy any figures or holding a pencil differently or with weak pencil grip necessitates further referrals. So in terms of receptive communication, so at 4 years old, we expect most of this child to follow more complex commands, meaning 3-step commands. So they're able to name things when actions are described and understand adjectives. At 5 years old, we expect them to know the right and left on self and enjoys rhyming words and alliterations. So at 6 years old, they can tell which one does not belong and ask what unfamiliar words mean. So red flags would include difficulty understanding preposition or difficulty answering simple WH questions or telling simple stories. In terms of expressive communication, so at 4 years old, we expect the child to have 100% intelligibility, meaning whether it's the parents, the caregivers, or unfamiliar people, they will be able to understand what the child is saying. Okay, so they're able to tell stories. At 5 years old, they're able to respond to why questions and repeat longer sentences. Okay. At 6 years old, they're able to describe events in orders or recite the days of the week. Okay? So when we say expressive communication delays, we noted that these kids have difficulty creating longer sentences or recalling or retelling stories in the past. Okay. Also, we also have to make sure or to take note of the grammatical or syntax errors in these children. Okay. Not just the merely stating the fact, but we also have to look into the intention to communicate. Meaning we just don't look at the number of words the child is saying, but we also need to look in how the child communicates. Because some children may be talking or retelling stories, but not really to communicate with their caregivers, but just to retell their interests, such as in the case of children with autism spectrum disorder. In terms of personal social skills, this is one area that is quite difficult to assess, especially post-pandemic, because we've seen a lot of children, especially the younger ones, having social difficulties. Most of them have difficulty initiating social interaction with familiar or unfamiliar peers. So, but by 4 years old, we usually expect them to have preferred friends, to be already doing group play aside from pretend play. They're also able to express emotions like happy, sad, angry. And 5 years old, usually they start having group of friends and saying sorry for their mistakes. And at 6 years old, usually most of these kids have a best friend or preferred friend, and they already enjoy going to school. The common red flags we see, especially post-pandemic, is most of these kids are socially withdrawn. They usually prefer to play with their cousins or siblings, but they have difficulty initiating interaction with other kids. Okay? So other warning signs would include solitary play or does not play with other children, challenging to calm down after being upset, and difficulties recognizing emotions of other people, or following rules or taking turns during games. Okay, so hopefully this is one of the areas that teachers, especially preschool teachers, could look into, because most of the parents, when we try to ask about the history of socialization, they usually say they're unable to comment because socialization skills of the child usually occurs in the school setting. So in terms of cognitive domains, so we expect at 4 years old, usually the kids would have a good 4 to 5 years old, good grasp concepts of pre-academic skills, such as identifications of letters, numbers, color, shapes. And at 5 years old, we expect them to start reading simple words or CVCs. And then at 6 years old, usually they're able to perform simple math addition or subtraction. Okay. So, but we have to remember that since the pandemic began, the exposure of screen time is quite high in most of the kids. So they, as early as 2 years old, a lot of them tend to memorize a lot about the color, shapes, numbers, and letters. So we also have to distinguish between rote counting or rote memory, between aside from the real identification of the concept. Okay, so anytime we noted that there's a difficulty in terms of recognition of these concepts, this would already serve as a warning sign. Okay. Adaptive domain, this is the area which is usually culturally affected. So especially here in the Philippines, most of the needs of the kids are anticipated, meaning the caregivers have already provided everything for the child. They don't allow the child to do things independently because most of the time they're on the rush. Number two, they have yayas or caregivers to help them do things instead of doing it by themselves. Okay, but usually at 4 years old, we note that most of these kids should already be toilet trained. They're able to brush their teeth alone or do button or unbuttoning. And at 5 years old, usually they do independent dressing or bathing. And at 6 years old, usually they're able to tie their shoelace and remember the things that they belong to them. Okay. So when we see kids with delays in adaptive domain, we always ask about the setting first at home, especially if there's no motor limitation in the child. Okay. Okay. So behavior. These are the common behaviors that parents would uh, complain: troubles with finishing tasks, does not pay attention for 5 to 10 minutes during activities, bullying, easily distracted, overactive, disruptive, aggressive, or difficulties with organizing self and belonging. Okay. But remember, when we look into the attention span, they always have the rule that as the child grows, each age corresponds to 2 to 3 minutes of attention span. So in a 5-year-old kid, we expect the attention span to be roughly about 15 minutes, no? But in a 3-year-old kid, we expect the attention span to be roughly around 6 to 9 minutes. So when we do in the evaluation, we always look into the chronological age of the child in terms of comparing its expected milestones or behaviors. So how then can we make sense of this behavior? So if a child is acting differently in school or at home, so we always have to consider the ABCs of behavior. So remember, behaviors also serve as tools for communication for children. They are a function of the antecedents that precede it and the consequences that follow it. Okay? So we have to look into the behavior about the antecedent, what happens before they do the behavior, the observable or measurable action, the behavior itself, and the consequence. So what do we do after we saw the child doing the behavior? So before we react to the child, we have to take into consideration what happens before and how would we react to the behavior. Okay. So recognizing the normal developmental milestones and the red flags leads us to the next step, which is what we can usually do in our clinics and especially in school. So according to the American Academy of the Pediatrics, so we have 3 tiers. It is the developmental surveillance or monitoring, which is usually done by parents and caregivers. So if most of the parents here would know that the pediatricians would parang introduce you to the baby book and you could see the different milestones written there. So some parents would try to write down all the milestones or do the checklist, okay? The second tier is the developmental screening, which is usually done by pediatricians. So in US, but also here in the Philippines, some pediatricians would already employ the recommended developmental screening at 9, 18, and 30 months, and the autism screening at 18 and 24 months. But the developmental screening, it could also be done by the early childhood teacher or the preschool teacher. Okay. However, there's really no formal screening tool yet that is recommended to be used by teachers. So most of the early childhood teacher would just write down their observations and recommend the parents for further evaluation. The third tier is done by the developmental pediatricians or the child psychologist, which is the comprehensive developmental evaluation to determine if there is a specific diagnosis and recommendation for the child. So it is very important for us teachers to monitor the children's development because you are always in the unique position to monitor their skills because you may be the first one actually to observe potential delays in the child's development. Okay. So once there is a developmental delay or special need is suspected, better to inform or report it to the parent in an in-person meeting. Okay. Remember, this would ensure that the child will have access to early and appropriate interventions if necessary. So this is one of the FAQs. They were asking how to tell the parents or how to disclose to the parents. So it is better to schedule the meeting ahead of time and then make sure don't try to fit into a hectic or like the pick up or drop off time of the child. and tell the parents ahead of time what the topic would be in the meeting and make it a private and comfortable area. Okay, then try to document the concerns and or collect the data so you could have a proof to the parents. And of course, you have to prepare what you're going to say. Okay, so usually we tend to see parents being difficult during this meeting, but it would always be an advantage if you start with the strengths, like what we do in the clinic. Just first tell the parents what are the skills of the child, what are the positive notes that you observe on the child, and then before you go into the developmental behavioral concerns, and try to be respectful, honest, open, and positive. Okay? And then if the parents' reaction, usually these are the parents' reaction, confused, frustrated, defensive, or confrontational. So just acknowledge their feelings. You can opt not to give a diagnosis, and then just try to be empathic and agree to revisit the issues. Okay. So remember, we're doing this for the child's benefit. Okay. So don't be afraid to tell them if you have any concerns. But it's really up to the parents if they're willing to let the child undergo a evaluation. Okay. So the neurodevelopmental disorders that we see in our clinic are varied, especially depending on the age group. So I'll just share with you some of the common neurodevelopmental disorders that you might also be encountering in your students. Okay. So neurodevelopmental disorders are a diverse group of chronic disorders that begins during conception, birth, growth, and lasts throughout an individual's lifetime. Okay. So actually, there are a lot of conditions which is under the neurodevelopmental disorder. So the common are the global developmental delay, intellectual disability, autism spectrum disorder, communication or language disorder, learning disorder or cerebral palsy, and sensory impairments. But lately, we have been seeing or included the high-risk infants. So these are the babies that are born out of the prematurity or who have had extensive conditions at birth, who are admitted in the NICU or NICU. Okay. So the worldwide prevalence of disability showed that about 150 children less than 18 have disabilities. Okay, this is according to the WHO and World Bank studies. Okay, in 2019, there have been a significant increase across the number of disabilities in different conditions, whether it be attention deficit hyperactivity, autism spectrum disorder, or intellectual disability. According to the Department of Education estimate, this is quite underreported, that there are about 444,000 children with disabilities in the Philippines. But this is just pertaining to the learning disability in children. Okay. So knowing this one, so these are the common developmental disabilities that we encounter. So some of the teachers might have seen developmental evaluation reports citing global developmental delay in children. So when we say GDD, it is a subset of developmental disabilities wherein there is significant delay in two or more of the following developmental domains. So the term GDD is reserved for those younger than 5 years. So meaning after 5 years old, the developmental behavioral pediatrician should commit to a certain diagnosis, whether it's just language delay, autism, or if the intellectual disability. Okay, so actually it is a temporary diagnosis because after 5 years of age, we expect that IQ testing is more valid and reliable to older kids. Okay. So intellectual disability is defined as deficits in intellectual functioning. So it includes the difficulties in reasoning, problem solving, planning, judgment, academic learning, and experiential learning. The other criteria should also include deficits in adaptive functioning, meaning the child has difficulty in terms of the communication, social skills, adaptive skills, or schoolwork and functioning. Okay, so all these symptoms should occur before the age 18 or during the developmental period. Okay. So the management we usually do for children with GDD or ID includes diagnostic workup to know about the etiology, to address medical concerns if there is, to provide necessary interventions, and to give proper school placement. So I think one of the common conditions we now see in our clinics after the pandemic is language disorder. Okay, so when we say language disorder, it is a persistent difficulties in the acquisition and use of language across modalities. Okay, due to deficits in comprehension or production. So usually these kids would have reduced vocabulary, limited sentence structure, and impairments in discourse. So the language abilities are usually below what is expected for their age, resulting to functional limitations in effective communication or academic achievement or occupational performance. So the symptoms usually occur during the early developmental period, and this should not be accounted for by other impairments like intellectual disability or sensory impairments. So what we usually do is to determine the etiology. Most of the kids we request for a hearing test, and we refer for speech and language assessment and therapy. So autism spectrum disorder, it accounts for about 75 to 80% of the children we now see in our clinics, whether it's the first consult or whether it's a follow-up patient, okay? So when we say autism spectrum disorder, the children have persistent deficits in social communication and interaction, and they also have restricted and repetitive behavior patterns. So usually they present in different manner. Such as, okay. So briefly, I'll just show you that the autism prevalence has increased 317% since 2000. So in this year, according to the CDC, we see autism spectrum disorder in 1 out of 36 kids. So usually in our classroom, if our class size is above 30 to 40, usually there's one children diagnosed with autism spectrum disorder. Okay? So it's really very different from the previous years. Okay, so how about we still do not know the cause of autism and the cause of possible rise of the cases? Okay. So this is what I've mentioned a while ago, that autism looks differently from every children. So the typical presentation of autism are children who are nonverbal or who communicates with minimal words, with gestures or crying. They often play alone or do solitary play, and usually they love trains, letters, dinosaurs, planets. They usually have poor eye contact and frequent meltdowns or tantrums, okay? So a lot of these kids also presents with difficulty in terms of sleep, and picky eaters, okay? They're very highly sensitive, so a lot of them are very sensitive to sounds or certain textures, okay? However, lately we've been seeing a lot of children with autism with a different presentation, okay? Some would say hi to everyone, goes out and talks to everyone, okay? They have advanced vocabulary. Some of my patients would be able to really carry out conversations. However, the conversations tends to be repetitive, or they tend to talk about the things that they're only interested in. Okay, so some of these kids are really very difficult to identify, except when we do a thorough history. Okay, so remember, the common ASD signs and symptoms are actually changing. Okay, these are the common features that we see. Okay, however, we have to take into consideration that autism is comprised of a pattern of differences, and it's not just one or two things. So it's really difficult to diagnose autism merely by saying that the child is inconsistently responds to name or does not have a good eye contact. Okay, so you have to get good history and do really thorough observations of the child. Okay, so what we usually do for children with autism is, number one, educational intervention. So as much as possible, if the child is able to follow through tasks, have a good, fairly good sitting span, and does not hurt other kids, we try to enroll them or include them in regular class to provide more opportunities for socialization. Lately, we have been advocating parent training programs for the parents of children with autism, especially nowadays that we have limited numbers of occupational and speech therapies doing interventions for these kids. And usually structured teaching or low student to teacher ratio would be more beneficial for them. And of course, we do the other interventions like occupational, speech therapy, and social skills training for bigger kids with autism spectrum disorder. Okay. So for the teachers, you might have encountered a lot of children with specific learning disorder, okay? So when we say specific learning disorder, this is different from intellectual disability because the difficulties in learning and using academic skills might be present in at least 6 months in these kids. So usually this is what they commonly term as dyslexia. So most of these kids have difficulty in terms of word reading, understanding the meaning of what is read or comprehension, difficulty with spelling, written expression, dysgraphia, difficulties with number sense, facts or calculation, and mathematical reasoning. Okay? So the academic skills are substantially and quantifiably below the expected for the individual's chronological age. And this can be observed during school age years, okay? So usually the kids would present difficulty, especially when they start to enter grade 1, because as we remember, those topics we had in kindergarten are quite easy pa for the kids, no? So usually they memorize, they would be able to identify letters, numbers, colors, shapes. But come grade 1, it includes a lot of analytical, diba? And the demands are higher, okay? But when we encounter children with specific learning disorder, we also have to make sure that they don't have any other conditions such as language disorder, which is very common. A lot of children with language disorder tend to develop specific learning disorders, specifically in reading difficulties during elementary years. And of course, ADHD or attention deficit hyperactivity, which could also impair the learning of the child. Okay. So sadly, since 2019, the UNICEF or the different studies pointed out that about 90% or 9 out of 10 grade 5 students have difficulty reading and understanding simple stories here in the Philippines, okay? So this is also a comparative studies among the different Asian countries, no? So hopefully we have to do something about it. This was further aggravated, the learning crisis worsened during the pandemic, okay? Especially since we shifted to online modules or asynchronous methods. So the method of learning was really not consistent for the kids, okay? In practice, especially last year, I've encountered a lot of students entering grade 4 and grade 5 with just letter recognition, okay? They have difficulty even combining words or like reading the phonics, okay? But how come they're able to move up to grade 4 or grade 5, okay? But because during the last 2 years of the pandemic, it is the caregivers or the siblings who would help them out during their homework. So there's really no actual assessment of the child. And come grade 4, to the surprise of the teacher, the child would have difficulties in terms of reading instructions or reading simple stories in class. Okay? So this further aggravated even in math and sciences because this child would have difficulty comprehending the questions during examinations. Okay. So according to the 2022 World Bank study, about 91% of these 10-year-old students were found to be lacking in basic reading skills. So hopefully the Department of Education and the school could do something about it. Okay. So management of specific learning disorder would include multimodal approach. We usually do reading remediation programs or tutorials, and we also provide or suggest modifications for the school teachers. Okay. So it would be nice that if you have encountered children with specific learning disorder, if they're already doing interventions, I would suggest for the teachers to try to collaborate with the reading specialist or sped tutors so that you can aid the child in doing better in the class. So these are just some of the modifications or accommodations that we can do, like decreasing the size and then adjust the level of difficulty for the child so to lessen the frustration. Sometimes we also allow them to allot them more time to finish the written task or reading task. And for some kids that really have difficulties in terms of writing, some schools would allow them to just type or their inputs or their homeworks, or to do video tasks instead of writing it down, especially if it would take a lot of time for the kid. Okay. So this is one of the common concerns in school-age children. So we've been receiving a lot of referrals even as young as 3 years old, complaining of hyperactivity and inattentiveness in children. So when we say ADHD, it comprises symptoms of inattention and hyperactivity. Okay. But usually it's difficult to diagnose ADHD in less than 5 years old, as it is the peak time that the children would be very active. Okay. So a lot of these kids have difficulty resting. They would be moving from one place to another, climbing and jumping. And also when you ask them to sit down, they tend to fidget or do something else instead of listening in class. Okay. So in females with ADHD, usually the symptoms of inattention are more prominent. So they're having difficulty sustaining attention, they tend to be forgetful or avoid tasks requiring sustained attention, and they tend to be careless while doing their tasks. So sometimes they're also being noted to be like daydreaming or spacing out during class or appearing not to listen and easily distracted. Okay. So the symptoms occur usually before age 12 years old, and it should have a minimum of 6 months. Okay. So the common misconceptions about children with ADHD, most of the caregivers would comment that they are just kulang sa pansin, it will be easily outgrown, it is typical for a young boy to be very hyperactive, he's just lazy, it is because of high sugar intake or poor parenting or home life and poor teaching style in school. Okay. However, we have to take note that for the school-age child, the developmental demand is quite high, okay? So remember the ADHD academic demands, we have to consider the nature of the schoolwork and the impact of school performance. Okay? So usually there is the learning gaps that we note in these children, okay? So they usually perform poorly on achievement tests and failed grades courses significantly more often than children without ADHD. And then they're more likely not to graduate from high school. Okay, academic impairment are more profound when learning and intellectual difficulties are also present. So usually we have to take into consideration when we see the children struggling in school to look into other possible reasons. So management of ADHD encompasses shared responsibilities, okay? So not just for the child and the parent, but for also the doctor, the teacher, and the school. Okay. So the common management we provide for ADHD is behavioral management strategies or occupational therapy for children below 5 years old. But in other countries, the recent guidelines in Canada in 2021 recommended that children as young as 5 to 6 years old with ADHD, they already start medications like methylphenidate on top of the behavioral management strategies. But here in the Philippines, we usually encounter parents who are hesitant to give medications to the kids. So they would usually try out doing occupational therapy first. But if we noted that there's really no improvement or minimal improvement after a few months of therapy, then we would start giving medications to the child. Okay. So these are just some classroom accommodations for children with ADHD that for the teachers that you might be able to provide, like, for example, asking them to be seated in front, okay, and then reminding them to be more organized in their table to provide less distractions, and like provide assignment notebook, or for ask them to list down the things that they have to do, okay. So provide visual schedules. This is very effective, especially at home, that the parents could talk about the routines or the schedule that they have to do, and then the child could just mark it down if he's able to finish those tasks, okay? And then, okay, for reading and comprehension, so some would have color coding, highlighting key information, okay, so reduction of visual distraction, and siguro less information on a particular page, okay? So because most of the kids in with ADHD, when they try to do tasks, especially like exams, they would really look into how long will the exam be, how many items, and then they would already start complaining even before they start answering the first part of the exam. Okay. So to support auditory comprehension and understanding, so avoid auditory distractions, always giving cues to the child before giving directions, and then the physical proximity or touch is very effective for them. So usually we recommend them to be seated in front of the class, so the teachers could easily get their attention back. Okay. Knowing all these conditions, it is important to recognize why early referral and intervention should be instituted in these children. Okay? So let me share a video from the Harvard University about the basis for early referral and intervention. Okay. Wait, let me share the... Ma'am, have you enabled yung sound?
Yes po, yes po.
Okay.
Pero mahina po yung lumalabas.
Okay. Kasi kanina nung I tried, malakas naman. Wait lang.
A child's experiences during the earliest years of
Okay
life lasting impact on the architecture of the developing brain. Genes provide the basic blueprint, but experiences shape the process that determines whether a child's brain will provide a strong or weak foundation for all future learning, behavior, and health. During this important period of brain development, billions of brain cells called neurons send electrical signals to communicate with each other. These connections form circuits that become the basic foundation of brain architecture. Circuits and connections proliferate at a rapid pace and are reinforced through use. Our experiences and environment dictate which circuits and connections get more use. Connections that are used more grow stronger and more permanent. Meanwhile, connections that are used less fade away. Through this process, neurons form strong circuits and connections for emotions, motor skills, behavioral control, logic, language, during the early critical period of development. With repeated use, these circuits become more efficient and connect to other areas of the brain more rapidly. Like building a house, everything is connected, and what comes first forms a foundation for all that comes later.
Okay, so that's why it's very important that during the early sensitive periods of development, we would already instill the early intervention programs for these kids. Okay, a less differentiated brain of a younger child is more amenable to intervention. So according to studies, it takes at least 4 times as long as to intervene in fourth grade student as it does in late kindergarten because of brain development and increased content for students to learn as they grow older. Okay, so early intervention is also an opportunity to avert secondary problems such as low esteem or low self-confidence. Okay, so the basis for early intervention includes improved developmental trajectories for children with disabilities. It also helps families care for their children and advocate for services and gain access to systems of support. Okay. So finally, I will be sharing a bit about the effects of pandemic in children as it is one of the most common FAQs by the faculty. Okay. So in 2020, we didn't expect that we would be having a prolonged lockdown, causing shifting of academic modules to modules or online platform. Okay, so it was quite an adjustment to everyone, especially for the teachers and also the students, and of course the parents as well. Okay, so actually the Philippines is one of the last few countries who went back to face-to-face classes. Okay, most of us resumed face-to-face classes only last year. Okay, so the pandemic has caused sudden school closure and shifted to blended learning, which challenged all the teachers, learners, and the parents. Okay, from face-to-face, we shifted to online and modular platform, but however, not everyone was able to adapt or thrive. So the consideration of accessibility to technology, electricity, and connectivity was also a main issue. So the learning spaces were also limited, and the students have difficulties in online class. Most of them would complain that they are bored. Okay, presence of responsible and supportive adult was also a requirement during that time. Okay, so it causes the exacerbation of educational disparities, and it also reduced the opportunities for the most vulnerable children. Okay, the impact of COVID-19 not only affects physical but also mental health of these students. Okay, so the pandemic brought about a lot of anxiety, isolation, disruption in our lives. The adverse childhood experiences and toxic stress especially affected our children. So science tells us that there's a strong link between childhood experiences and adult outcomes, which also impacts lifelong health. Okay, sharing with you the latest studies in 2022 to 2023, it showed that too often the adverse childhood experiences disrupt young lives that have barely just begun. Okay, so although they don't predetermine the child's fate, the experience can also jeopardize the prospects for having a healthy or fulfilling life. Many children who suffer trauma became hypersensitive to the needs of others withhold their own emotions. Okay, students who also face trauma find it more difficult to engage with their schoolwork. Okay, so students with 2 or more adverse childhood experiences are 2 to 2.5 times more likely to fail a grade. Okay, so we have seen these studies across US. Okay, so hopefully we as primary teachers or caregivers for the child would be able to help them alleviate the toxic stress. Okay, so how does the COVID-19 pandemic affects children and adolescents? So basically, the increased parental stress, the suspension of classroom activities, poor nutritional status or lack of physical activities, since most of the kids are staying home and using their gadgets. And then the chronic exposure to toxic stress. Okay, so this would cause a haywire effect on your body. Okay, so what can we do now to help these kids? Okay, this is very important, especially for us clinicians and teachers. So it is important to always go beyond grades. If your student, if you feel that your student is struggling, try to look into observing if there are any anxiety, rejection, especially in adolescent, if there are suicidal tendencies. Okay, so it's not all because of grades. No, we have to look into the factors while the child is not performing that well in the classroom. Try to be supportive and empathetic and look after the child's mental health. Okay, so it is also important to try to talk it out to the parents or ask how's the environment at home. Okay, so moving forward, how do we help these kids? Okay, so we try to help them feel good about going back to school, since social interactions are very crucial in the development. You know, it's quite hard for the kids, especially for the younger ones, to adjust after the lockdown because they're not used to physically greeting and affection or sharing and playing with other people. So due to the no touch or physical distancing, no sharing, do not touch the other kids' items or always clean hands, it is really evident in them to have difficulties initiating interaction. I'm not sure if the preschool teachers would also have the same observations, but this is what we have observed in our clinics as well, those kids doing therapy in the therapy centers. Okay. So not just the younger ones, but the impact of COVID-19 pandemic showed great adjustment also to the young or adolescent students. Okay, the teens have already suffered in terms of poorer executive function and socialization skills. Okay, remember kids nowadays are less resilient. They complain easily. They don't have that much patience or a good attitude to work with other kids, unlike our times before. Okay, so actually this is an article by Ma'am Anna Cristina Tuason. She's actually a academician in the UP Diliman. Okay, so it is one of her observations that a lot of kids have difficulty working with others. Okay, so it's not just giving them homeworks or giving them group projects to do, but it is also important for us teachers to teach them how to work as part of the group, how to resolve disagreements. Okay, so we should not only assign projects, but we also have to teach them how to be effective members of a group. Okay. So finally, we briefly discussed the effects of digital addiction in children as one of the common questions by some of the teachers. So how do we measure the effect of screen time or impact of technology on children? So of course, there's the positive effect, educational opportunities, like children as young as 2 years old tend to memorize a lot about letters, colors, sing the alphabet song, recite the numbers. They become increasingly creative. Okay, they have better communication and socialization skills in terms of like doing Facebook Messenger or the chats or video calls with their parents or grandparents, and then they have more information or access. Okay. However, there are also the negative effect of screen time, especially if left uncontrolled by the parents or caregivers. So this is addiction or dependency, poor academic performance, social isolation and behavioral issues, developmental problems, and online risk, because we cannot control what the kids are searching or looking up in the internet. Okay. So I'll just briefly share two recent studies. These are both 2023 studies. Okay. The first study is done here in the Philippines. It was just released early this year. Okay. So it measured the effect of screen time on the development of children in the Philippines. So they have about preschool children, and then they try to measure the effect of screen time. Okay, so the study found that spending more than 2 hours of screen time, especially among 2 years old kids, have poorer language development. But this is less aggravated if the parents would or caregivers would co-view with the child. Okay. So another effect is the relationship between screen time and the ADHD. This is done in China. And they have actually similar studies across different countries also, that they have an increased risk of developing attention deficit hyperactivity disorder symptoms. Okay. As you see, if you try to watch the YouTube videos like Cocomelon, usually they have a lot of scenes or a lot of change in screen in a period of 5 minutes. So tendency is the child's brain begins to rewire very fast. So you would observe these kids to be easily angered, they have more temper tantrums, they're easily inattentive, and they easily get frustrated. Okay. So according to the American Academy of Pediatrics, these are the new recommendations for the screen time for kids. Okay. So for 18 months or younger, usually no screens are still the best. Exception is live chats with family and friends. Okay. For 18 months to 2 years old, choose high quality videos. We really cannot advocate totally no videos because a lot of caregivers or parents here in the Philippines are also the primary caregivers or the one doing everything at home. Okay, but we try to recommend limiting screen time, and if possible, they would try to co-view with the child instead of allowing the child to view on his own. Okay, so for 2 to 5 years old, limit screen time to 1 hour a day, and then parents should make sure of the content the child is watching. For 6 years or older, place consistent time limits, because as we all know, the more time they spent on gadget, the less socialization they would do. And of course, in terms of eye findings and ear findings, a lot of ophthalmologists and ENT also have been seeing quite a number of patients with eye and ear problems due to increased screen time. Okay, so how do we help these kids? Okay, so recommend to establish routines at home, to establish a good relationship with caregivers or with friends in school, and of course to establish resiliency. Okay. So if you think that the child might have any developmental delay, academic or behavioral concerns, do not hesitate to talk to the parents and refer for professional evaluation and intervention. Remember, knowing all these things, the milestones, the red flags, it actually doesn't determine a child's value or the parent's worth or value. Okay, we just want to advocate for the child to provide early intervention as necessary. Because when we do early detection and timely diagnosis, and to give the child appropriate referrals, we could expect for the best possible outcome. We are in a multidisciplinary team, so it is important not just to work with pediatricians, neurologists, the therapists, but it's also very crucial for us to work with teachers. So you are usually our first line, especially in determining behaviors or academic capabilities of child in the school. So hopefully we could work more actively with the profession, this profession. Okay. So remember, every child deserves parents who will never give up on them, who understands the power of connection and insists they become the best that they can possibly be. But it also takes a village who will fill in the gap. Okay. So these are my resources. And thank you po for listening.
Thank you very much, Dr. Bernice, for that enlightening discussion you have given us. What you've shared with us will surely be useful as we continue to guide these children. So at this juncture, we are opening the floor for questions, comments, and clarifications. You may now send your queries through chat or raise your hand before you unmute your microphone and ask your question. We have here question po. Hindi po medical related, but I want to ask about your opinion or input about educational approach, system, curriculum here in the Philippines compared to other countries such as Japan.
Okay. Sige, ma'am. Ma'am, actually, we have been, parang there was really issues, diba, in terms of the shifting to K-12 because the gap was quite big, especially when we look into the curriculum provided by the kindergarten, and then suddenly in grade 1, okay? However, we have parang voiced it out several times already to the Department of Education that we have to do something about filling in the gap for these kids, diba? Because we see a lot of grade 1 students struggling really because usually during our time, we started grade 1 at 7 years old. So developmentally, we really expect children to be able to read and comprehend simple stories at around 6.5 to 7 years old. But with the current curriculum, diba, in grade 1, parang in second quarter, usually we already expect them to be able to read the instructions on their own, diba? So there's really the big gap that we have to resolve.
Next question po, what are the usual reaction of Filipino-Chinese clients and how do you usually communicate with them?
Usually for Filipino-Chinese clients, they are less receptive. Actually, they're more difficult for them to really understand the condition because especially if the child is able to do a lot of things. No, lately I've been seeing a lot of Filipino Chinese clients with autism spectrum disorder. So it's really quite difficult for the parents to accept. But there's also a number of parents who are parang when they seek consult, they already know naman na there's something wrong with the child, especially if the child have older siblings. But you really have to be straightforward to them. And then you really have to give the necessary recommendations for the child, even though they're quite hesitant about it. Some would actually say that it took them some time before they have the child started therapy because they have difficulty accepting the condition. But when they see the child improving after doing the therapy, then it's more encouraging for them to proceed with the interventions.
Is it necessary for a school to have a multidisciplinary team?
Yes.
Like the OTP?
Yes, it should be.
Other questions po?
Actually, ma'am, in other schools, kasi they're very, open to that. Like there are some really, even if they don't have in-house OT, PT, or speech, but I think they have parang mga partners, yung ganon. So at least, if there's a child needing parang evaluation, at least they have somebody to partner on or to ask on about the condition of the child. Because it's really difficult to identify kids with developmental delays, especially with the current scenario. A lot of parents would be telling you it's just because of the pandemic that my child is not talking that well, not socializing that well. So at least if you have that arm in the school, then maybe there's somebody who can really reach out to the parents better. So it would also lessen the burden to the teachers.
Yes po. Question from Miss Leia. Where to go for a DevPedia? The waiting is too long. Wait until 6 to 1 year.
Yes, ma'am. Actually, the common waiting time is between 6 months to 1 year. Why? Because there are only less than 90 of us in the entire Philippines. And then the number of referrals have greatly increased since last year, May. Last year when the students start going back to school. So even in other schools, the preschools, we tend to get referrals as early as 2.5 or 3 years old because of the reasons of hyperactivity or speech delay. And it takes about at least 1 hour or 1.5 hours for an evaluation. So hindi po namin siya mamamadali. Unlike the usual, di ba, pedia consult, ma'am, it's usually 15, 20 minutes, maximum na 30 pag may mga problems yung child, no? But usually for us, it takes at least an hour or an hour and a half. Depende pa po if the informant will be very reliable, if the child will cooperate. And then we also have to explain it to the parents kasi thoroughly. So it really takes that much time. So very limited din po yung number of patients that we can see in a day.
Question po, what are your advices in handling older students who have undiagnosed developmental disorders or older students who have learning or intellectual or language disorders?
Okay. Ma'am, yun lately, it is quite parang popular in our clinics to receive a lot of yung mga teenagers na po or adolescent with learning difficulties. But when we look back, usually they would start having concerns na as early as preschool, mga 4 to 5 years old, may mga language or learning difficulties na, no? But usually it becomes more evident as they grow older because of the increase in demands in the school. But usually if the teachers would pick up that out, please advise the parents to seek for professional help. So at least we can intervene. Like for bigger kids, we also do IQ testing. We would recommend to do IQ testing. So at least, or neuropsychological testing. So it would also help the teachers in terms of how to adjust or do the necessary accommodations in class. But if we remain, these kids remain undiagnosed, it will really be a struggle for them, especially now with the current curriculum. I have 2 or 3 kids like that, ma'am, na nakita na po at around 15 lang. So with the difficulty in reading, comprehension. So now the parents sought consults because they don't know if the child could still proceed with college. So it's really difficult for these kids also because they tend to be really frustrated on their own skills.
Good morning. You mentioned a while ago that the Filipino Chinese community is quite receptive regarding certain concerns regarding conditions of their children. Because this is a very beautiful seminar to begin with. I love the title, From Observation to Intervention. It's just that, for example, in high school, we do observe some students with conditions. However, um, we know that we cannot label students, right? We cannot
Yes.
label them unless they are diagnosed. So
Opo.
whenever we would want to refer to the parents, it seems that they would not. Again, as what you mentioned, they're quite defensive and receptive about it. So what happens now is that nothing is done about that. But as teachers, we feel that there's really a need to do so. However, the parents would not respond the way we want them to respond to help the children. So, what can we do about that, ma'am? What would be the concrete pieces of advice you can give us as educators who have this genuine concern for our students with such conditions? Thank you.
Okay. So, Sir Alan, so usually the ones that we really see, the Filipino Chinese parents who are more receptive are those with the younger age group. Okay. But those that I've encountered with the older ones, they're usually late referrals na po, no? So because of the resistance of the parents, because they felt that the child has been doing very well for the past few years. Okay. So usually it would be important siguro to really write it down, baka communicate it with the official letter talaga. And then kasi some schools talaga, they would insist that you have to have an assessment na before we take in for the next enrollment. At least we know how to help the child. Kasi sometimes if you don't make the formal letter din, baka they would think na, okay, it's just an advice for the teacher that we can opt to do it or not to do it, diba? But sometimes kasi we see a lot of these teenagers or high school students really struggling na po talaga in school, diba? So it would be better, like, siguro there would be a system talaga in the school, like if the teachers would know, would have these observations that Would we write it down? Would we formally inform the parents with an official letter, di ba? Para at least po, it would also help you out in terms of helping the child during the everyday activities in class.
Thank you so much, Doc. That's
Thank you rin
great. Thank
po.
you.